All right, welcome back to ABA exam review and the continuation of our BCBA exam practice question series. We're going through the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials. They're affordable and you can get our combo pack, study guides, and practice exams. As always, when you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A skill acquisition plan is written that includes several steps that the behavior technician must follow each time the plan is implemented. One step involves an intensive procedure of taking trash to a dumpster that is half a mile away. The technician will often skip this step and continue on to the next step while providing service. What could be said about the technician's treatment? Okay, so we're looking at the technician specifically and their treatment. So, what is the treatment? We're using a skill acquisition plan that includes several steps that the technician must follow each time the plan is implemented. However, the technician often skips the step that involves an intensive procedure of taking trash to a dumpster that is half a mile away. So, since for whatever reason, whether the step is too intensive, the technician forgets, doesn't feel like it, whatever the reason may be, the technician is not implementing this plan as intended. So, what could be said about the technician's treatment relative to how it's being implemented? A, it lacks integrity. Sure. When we are looking at things like treatment integrity, we're looking at how are the steps being implemented? Is it being implemented as written? And it's clearly not because the technician is skipping steps. So, what about B? It lacks fidelity. Yes, as well. Integrity and fidelity are the same. When we talk about treatment fidelity, treatment integrity, procedural fidelity, what we mean is, are we following the plan as written? In this case, are we including every step as written and as intended? Clearly not. So our procedure is lacking integrity and it's lacking fidelity. Now, what about observer drift? Well, observer drift has more to do with what we're measuring and what we're observing as far as the behavior is concerned. And since this question is not dealing with what we're measuring or observing, we're not really talking about observer drift here. We're much more alluding to the fact that we're losing integrity or we're losing fidelity because this technician is skipping a step. So our answer here, what could be said about the technician's treatment, is D, both A and B. Amber is hoping to hand out Christmas presents to her younger cousins as well as her nieces and nephews. Amber's brother slides the presents closer to Amber that he wants her to hand out next. Amber grabs these presents and distributes them to the right person. What type of prompt is the brother using? Okay, question is asking about the prompt that the brother is using. So we're looking at the brother and his prompting. We know Amber is helping hand out Christmas presents. Amber's brother, who we're looking at, does what? Well, he slides the presents closer to Amber that he wants her to hand out next. As a result, she grabs these presents and distributes them. So, what is the brother manipulating? Because when we talk about prompts, let's think about stimulus versus response prompts. With the stimulus prompt, we're manipulating the antecedent stimulus. With the response prompt, we're acting directly on the response. So, typical response prompts are physical and modeling. With stimulus prompts, we may be altering the size of the stimulus, or in this case, moving the stimulus around. So, what type of prompt is this? A movement prompt. Don't get movement prompts confused with positional prompts. Movement prompts could also be called gestural prompts. What we're really doing here is B, a positional prompt. He's taking the stimulus, the presence, or the stimuli, the presence, and moving them closer, thus getting Amber to grab the right presence. It's not a response prompt because we're altering the antecedent stimulus, not necessarily acting directly on the response. And it isn't modeling because he's not modeling which presence he wants. He's actually manipulating the stimulus, which is the present, in order to evoke the response he wants to see. So the prompt he wants, or the brother's using, would be a B, positional prompt. So prompting questions, understand, am I dealing with a response prompt or a stimulus prompt? And then what specific type of prompt is it? So know those two things for each prompt question. I've taught my toddler to throw a ball whenever she is holding a ball in her hands. I now want her to drop the ball instead of throw it so that she can kick the ball. What am I trying to teach in this scenario? Okay, pretty straightforward question compared to the first two. What are we teaching in this scenario? You've taught your toddler to throw a ball when she has it in her hands. You now want her to drop the ball instead of throw it so that she can kick the ball. Now, when we're looking at teaching, right, we can start with, let's say, discrete trial and naturalistic teaching. In this case, we're not really discussing naturalistic or discrete trial because we're teaching something specific. So then ask yourself, well, is it functional communication? Well, no, we're not teaching communication in this scenario. What we're teaching is these different responses. And so when we get into different responses and different stimuli, we start thinking about A, stimulus discrimination, or C, response differentiation. And so we've ruled out B, functional communication. We're not teaching communication. So therefore, we're not teaching expressive language. So is it discrimination or differentiation? Well, discrimination, we would be teaching the toddler to identify or tell the difference between different stimuli. She's not doing that here, right? Because the stimulus isn't changing. It's still the ball. She's holding the ball in her hands. But instead of throwing it, you now, or this person now, wants her to drop the ball. So he wants the response to change. Therefore, he wants to teach a different response in this situation. He wants her to differentiate the response. Response differentiation and stimulus discrimination can both be taught through differential reinforcement, but they're not the same thing. Discrimination has to do with the different stimuli that we're telling the difference between. Response differentiation has to do with changing up the different responses in these scenarios. Instead of throwing, we're now going to drop the ball. We're engaging in differentiation or response differentiation. Therefore, that's what we are trying to teach. Your phone is set to vibrate when you receive a text message or a phone call. During a meeting today, you saw your boss's phone vibrate, so you reached for your phone and checked it, but didn't see any messages or calls. If this scenario happens enough, what is the likely outcome? All right, kind of a vague question. So we're looking at the scenario happening a lot and then what that might lead to. So let's evaluate the scenario. Phone is set to vibrate when you get a message or a call. During the meeting today, your boss's phone vibrated, so you reached for your phone and checked it, but you didn't see any messages or calls. So what is happening here? So typically, when your phone vibrates, you check it to get a text message or phone call. Today, your boss's phone vibrated, so you checked your phone anyway. Now, obviously, since your phone didn't vibrate, you won't get a message or call. You're not getting the reinforcement for checking your phone. What is likely going to occur from this scenario? A, you will continue checking your phone when your boss's phone vibrates. Well, no, when your boss's phone vibrates, that's not signaling that reinforcement is available on your phone. Your phone has to vibrate to signal reinforcement is available on your phone. So it's very unlikely if each time you check your phone without any notifications that you would continue checking your notifications, especially when somebody else's phone vibrates. So it'll be you will stop checking your phone when your boss's phone vibrates. Yeah, that's much more likely, right? Because we're talking essentially about stimulus control here, right? So currently your boss's phone vibrates and it has stimulus control over you checking your phone. But if it occurs enough where you're not getting reinforced for it and you're not getting text messages or phone calls, you're eventually going to stop that behavior. It's going to lose stimulus control. C, you will stop checking your phone when it vibrates altogether. Well, no, because when your phone vibrates, you'll still get your reinforcement from your text messages or phone calls. You're just not going to get that same reinforcement from your boss's phone vibrating. And then D, you will start checking your phone at random times throughout the day. There's not really an indication that we're going to start randomly checking our phone because we're specifically referring to the situation where the boss's phone vibrates. So the most likely scenario, if the boss's phone vibrates, you check your phone, don't see messages or calls, is that you're going to stop checking your phone when your boss's phone vibrates altogether. Sammy is a great singer. She memorized her mom's favorite song so that she could sing it to her on her birthday. But when it was time for Sammy to perform, she saw that over 100 people were at the party and she forgot the words. What is likely occurring? All right, so we have Sammy here, who's a singer. She memorized the song so she could sing it to her mom. It was time to perform. She forgot the words because there were over 100 people at the party. Now, think about these situations, let's say in sports, where people choke and they have a bad game, even though they're well trained, or cooks cook a bad meal, or you have a bad meeting, whatever it might be, right? You know how to do something. You get into a situation, and for some reason you mess up, or you can no longer do it. Why does that occur? Well, masking is what we're talking about here. Masking is when you have the behavior in your repertoire, or there is stimulus control over a behavior, but another stimulus in the environment or stimuli in the environment are preventing the response from occurring. And that's what's happening here. The 100 people at the party are masking Sammy's ability to perform. Overshadowing is similar, but overshadowing is the learning of the skill is overshadowed by something else in the environment. Masking, we know the skill, it's just being masked because of another stimuli in the environment. In this case, 100 people at the party. And then C, regression. As always, we don't use regression in technical terms. It's not a technical word. In practice and in casual conversation, you might say it. It is not an analytic term. What is likely occurring here is A, masking. Sammy's ability to perform is masked by the people at the party. A behavior analyst observes that a client loves to eat cauliflower as a snack. The analyst believes the cauliflower could be a great way to motivate the client to complete different tasks. The analyst asks the client's parents to not serve cauliflower outside of treatment, to which the parents agree. Is this scenario ethical? Okay, so we have an ethics question. Let's break down the scenario. We have a behavior analyst who sees the client likes to eat cauliflower. All right, so potential reinforcer. Analyst believes cauliflower would be a great way to motivate the client. Okay, so what does the analyst do? They say to the parents, please do not serve cauliflower outside of treatment, to which the parents agree. Now, why would they do that? Well, they're trying to deprive the client of cauliflower, making it more valuable. So when we use it during session, it's more valuable, right? It's more likely the client will engage in behavior to gain the cauliflower. Is it ethical? A, no, the cauliflower likely poses a health risk to the client. Now, edible reinforcers are an ethical concern for this reason, depending on what you're using, which are typically going to be sweets, because kids like candy, they like chips. However, cauliflower is not necessarily a health risk to the client. So that's not a concern here, given it's just regular cauliflower. What about B? No, the analyst cannot deprive the client of meals. Although true, the cauliflower is not the meal, it's the snack. And you can deprive them of a snack. Okay. Ethics say we can't limit necessities. So water, or 3 meals, or bathrooms, we can't limit that. Snacks, not a necessity. You can deprive them of that. C, yes, the analyst can use deprivation in this manner. Sure, I don't see anything wrong necessarily with this scenario. And then D, yes, if the parents agrees to treatment, then treatment is considered ethical. Well, that's not necessarily true. It can be a very unethical treatment. Parents may agree not knowing any better. Just because the parents agree doesn't make it ethical. Don't think that's the case. So, is the scenario ethical? Sure, the analyst can use deprivation in this manner. Thank you for watching. Check out behavioranalyststudy.com for all of our study materials. As always, subscribe if you have not already. Work hard, study hard. We'll see you soon.